Okay, so autism spectrum disorder is a condition related to the brain development that impacts how a person perceives and socializes with others, causing problems in social interaction and communication. The disorder also includes limited and repetitive patterns of behavior. The term spectrum in autism spectrum disorder refers to the wide variety of symptoms and severity that are associated with having autism. So autism spectrum disorder includes conditions that were previously considered separate. So Asperger's, childhood disintegrative disorder, and unspecified form of pervasive developmental disorder. Some people still use the term Asperger's syndrome, which is generally thought to be a mild end of autism spectrum disorder. Autism spectrum disorder begins in early childhood and eventually causes problems functioning in society, socially, in school, and in work. For example, often children show symptoms of autism within the first year of life. A small number of children appear developmentally normal in the first year and then go through a period of regression between 18 and 24 months when they develop autism symptoms. While there's no cure for autism at this moment, intensive early treatment can cause a big difference in the lives of the children who have autism. So some of the symptoms are that occur in early infancy, such as reduced eye contact, lack of response to their name, or indifference to caregivers. Other children may develop normally for the first few years of life, but then suddenly become withdrawn or aggressive or lose language skills you've already acquired. This usually is seen when the child turns around 2 years old. So each child with autism spectrum disorder is likely to have a unique pattern of behavior and level of severity, from low functioning to high functioning. Some children with autism spectrum disorder have a difficulty learning, and some have signs of lower than normal intelligence. Other children with the disorder have an abnormal to high intelligence. They learn quickly, yet have trouble communicating and applying what they know in everyday life into social situations as well. So because there's a unique mixture of symptoms in each child, severity can sometimes be difficult to determine. It generally is based on the level of impairments and how they impact the ability to function. The kind of social communication and interaction symptoms are fails to respond to his or her name, resists cuddling or holding, has poor eye contact, doesn't speak or has delayed speech, can't start a conversation and can't keep it going, speaks with an abnormal tone or rhythm, repeats words or phrases verbatim, doesn't appear to understand simple questions or directions, doesn't express emotions or ongoing feelings, doesn't point out or bring objects to share interest, inappropriately approaches a social interaction by being passive-aggressive or disruptive, has difficulty recognizing nonverbal cues. So patterns of behavior also can differ between children. So they can perform repetitive movements, they can perform activities that can cause self-harm, develop specific routines or rituals that become disturbed at the slightest change, has problems with coordination or odd movement patterns, is fascinated by details of an object. And then the causes are also kind of unknown. There's not really a single cause that causes autism, but the two that they think are genetics and environmental factors once again. And given the complexity of the disorder and the fact that the symptoms can range in severity, really hinder the process of developing a cause as well. There is no links between vaccines and autism disorder, but there has been great controversy surrounding that. The risk factors, your child's sex, boys are 4 times more likely to have autism, and the treatment that goes along with that. Since there's currently no cure, there's no one-size-fits-all treatment for each kid with autism. The goal of the treatment is to maximize your child's ability to function by reducing autism spectrum disorder symptoms and supporting development and learning. Early intervention during preschool years can help your child immensely, especially in the social communication, functional, and behavioral skills. The range of home-based and homeschool treatments are also really, really common for people with autism. Because the child doesn't enjoy change and has a hard time in social situations, so that sometimes can help. So behavioral and communication therapies, educational therapies communication therapy, family therapy, and a lot of other therapies can help with autism as well. And then managing their medical and mental health conditions. So that is another thing that goes along with having autism. So yeah, even though people have autism, it is a very non-invisible disease. I think it is, people can notice it, and it is easily diagnosed, in my opinion, as well. So yeah.